Welcome to India New England News. Our guest today is no other than legendary orthopedic surgeon Dr. Dinesh Patel. He is also going to give a talk at upcoming Health Expo on August 18th at Burlington Marriott. Hope to see you there. Today we are going to talk to Dr. Patel about what is the latest in orthopedic medicine, especially sports medicine, and also what are some of the challenges people face as they are aging. Can it be prevented? What are the precautions we can take care of? Also, so that you know, Dr. Patel is also father of the sports medicine in the world, which he really started here in Boston. So, Dr. Patel, welcome to our studio.
Thank you so much.
Excellent. And I really appreciate your time and looking forward to hearing you at the Health Expo.
Okay, thank you.
So, my first question to you is, a lot of people who are aging now, and they are in 50s, 60s, and as they head to 70s and 80s, we develop a lot of different type of issues with the knees, with the feet, with the hands. So the first thing is that what are some of those challenges which might come in the older age and how they can be avoided?
I think let me correct one thing.
Okay.
I'm not the godfather of sports medicine.
Okay. I said the father of sports medicine.
Okay. Well, I was interested in.
Okay.
As a former captain of my cricket team and badminton team in my college, I had deep interest in sports. So that led me into sports medicine, yeah. So answering your question, I think as we age, as you know, the tissues pliability decreases, so they get stiffer. They also have less vascularity, so injury, healing takes time. So I would advise people, and we all want to be fit. We all want to perform better. We all want to make it live longer. So I give 3 ideas, okay? One is protection. Second is prevention. And third is performance. So in order to protect yourself, I advise people that you ought to do anything you do in a slow, gradual increment. And in order to convince them, I give an example of a baseball pitcher. If you see a baseball pitcher, he doesn't pitch every game. He pitches now, takes 3 days off, and comes on the 4th day. That means that his muscles and tissues have to recover before he play. So same example we'll give it to ourselves. If you want to get fit, you think, gee, I want to get more fitter. So you just can't run 2 miles today. A little bit here, a little bit here, a little bit. Gradually increase the tolerance. But before you do this, I also advise people to do some flexibility. A lot of people are very tight jointed. The hamstrings are tight, the Achilles are tight, the shoulder joints are tight. So do a little bit of flexibility. Flexibility can be done by yoga exercises, for example, as an example. Or you can look in the Google and do some stretching exercises. So that is the first thing to do. Stretch, stretch, stretch. Gradually increase your sports, either running or jogging or tennis or whatever you do everything gradual increments. That will prevent your injury. Now, second is protection. If you had an injury in knee, for example, in past, but you want to do something, so you want to protect to get hurt more. So make sure you see the primary care physicians or orthopedic surgeons and look at the status of your knee or shoulder, hip or whatever. And you may need a knee brace. For example, if you had a torn cruciate ligament and surgery or arthritis in the inner compartment, in order to protect yourself for the injury, get a brace, unloading knee brace, get a brace for ankle so you can protect it. So prevention, protection, and then now you want to do performance. You also want to perform. So slowly and gradually increase performance.
So talking about the knee, I cannot resist, but I saw you brought something to show us. So just tell us how the knee functions and what are the challenges it can be. Okay. If you can show your model.
Okay. Sure. Well, this is the knee. Okay. The knee has got we call a thigh muscle, so quadriceps. So this is the front of the knee. The quadriceps muscles are the patella. So you may hear from doctors that this young ballet dancer or the young girl has a loose kneecap. So that loose kneecap is like this. So when kneecaps goes out, it hurts and you may get other roughness here or may roughness here. So that's the kneecap. The other component of the knee there are 4 ligaments. Outside ligament, inside ligament, and inside the knee, 2 ligaments. One is the anterior ligament, one is the posterior ligament. And on top of these, the most common problem that we all face with is the meniscus. If you hold it here, Upendra, there are 2 cushions. One is here and one is here. So when you say you got a torn cartilage, then this is what it tears. Here and here. So how does it tears? You tears by twisting motion. You twist, you grind, you squat, then it does it, or you jump and pivot. So knee consists of basically 2 meniscus, 2 cushions, 2 ligament inside the knee, and 2 inside and outside the knee, thigh muscles, and in the back there are hamstring muscles. These are the hamstrings here. So that's what the knee is. So common injuries in the knees are torn meniscus, twisting, turning, squatting, jumping, pivoting, torn cruciate ligament, which is becoming very, very common because of increasing performance, jump and pivot, and the anterior cruciate ligament gets torn. And then if you're a football player and you get hurt like this, you tore the outside and inside ligament. And if you are a loose jointed, for example, many young ladies are, then the kneecaps are flexus. So that's what the knee is all about.
So one question I have for you, I hear that a lot of friends and people I know, some of them have talked about that suddenly they are walking and suddenly they lose the balance because knees, something happens and like they have no control. So what that happens and can that be prevented?
Well, if you haven't had any injury before and you're walking, likelihood of you giving way it can be from number of factors. One is there may be something in the knee which is floating, like a loose body in your shoe. You got it, and so that's one aspect of it. Or you may have had a prior injury, and the cushion may get stuck in the knee, and reflexly the muscles are trying to protect your knee, and what we call a give way. The knee gives way. But this is uncommon because we are just walking, you don't give way unless there is something mechanically not right here.
Yeah. So now at the Health Expo, anybody can come and you will answer their all questions there.
Well, that's the idea.
That's the idea.
I think the thing is, which I like most about your Health Expo is that this is the very important aspect of community service. And you are doing a wonderful job year and year after your patient, your doctor.
This year is our 10th annual health expo.
Right. No, so you're doing wonderful job. You have a doctor from diabetes, heart disease, the yoga, the diet, nutrition. It's a multifactorial med expos. And on top of that, you also have all the interesting exhibits that we can visit and see what's happening here.
Sure. So now, what are some of the latest things we see in orthopedic surgery, or some of the things, our readers or viewers may not be aware of?
Well, latest thing, at least is understanding the mechanics of the knee, or mechanics of the hip, or mechanics of the shoulder. So we're beginning to understand the true mechanics. Other thing we're beginning to understand is the biomechanics. When you're playing golf or tennis, what happens to the shoulder? What happens to the knee? We were studying with all the engineers from MIT and whatever, the biomechanics of what kind of thing happened that you can correct it. The second thing happening. Third thing is happening is the materials, biomaterials are now coming in, which will help long-lasting things. And fourth thing is coming is called biologics. That we have a steroid, we have a platelet-rich plasmas, we have stem cells, and all of these are coming biologics to create other cartilage, or to create some lubricant, or create something so you don't need to go through new knee replacement. So this is the new thing is coming. And the final thing is coming, which is called a CAT cam and robotics. CAT cam, CAT scan. You take an X-ray of the knee, MRI, and from CT scan, you develop implant fitting your size. This is a new thing is coming. And the robotics are doing it. So robotic will do very precise surgery in the knee replacements or hip replacement. So that's the newer things are coming. Yeah.
Okay. So now, two other issues we hear all the time. One is the shoulder dislocation or something,
Right.
And also some wrist issues as well.
Okay.
So if you can very briefly talk about, maybe start with shoulder.
Okay. Well, shoulder has got a very different joint. He has got rotations all over. It's a ball and socket joint. So anything you do which overloads and not being flexible, you can hurt yourself. There are people who are loose jointed. So when you do this, joint is loose, it dislocates shoulder. What about to dislocate? If you raise the shoulder up playing tennis, it pinches here. That's because your shoulder is stiffer. So it's pinching and the rotator cuff gets torn. So here common thing is subluxation of the shoulder. Shoulder comes out by out. And here impingement, when you play, it impinges. These are the two common problems in the shoulder. Shoulder subluxation and shoulder impingement, rotator cuff tear.
So any exercise for the shoulder or any diet?
Well, diet, not diet. Okay. Exercise means you need to build up the shoulder muscles. Internal rotator, external rotator, abductors, scapular muscles. See what I mean? So if your muscles are stronger and the joint is flexible and you play sports in a graduated manner, then you are less likely to get hurt.
So I also hear that as you age, your ability to build muscles also decreases. How true it is, or it is false, or Is there any age limitation in building muscles?
No, I think you can build up the muscles.
You can build
You
up.
can build up the muscles. You may not be able to build as much, but I'm not sure that's quite true. You can still build up the muscles. Yeah.
Okay. And now coming back to the wrist.
Okay. Well, the wrist joint, the common problem, the wrist joint, is when you fall on the ice. Okay. When you fall outstretched arm and you fall right here, you can break the wrist bones. That's one of the most common as we age because we fall and do that. The other common injuries we get is this computer thing.
That was the next question I was going to ask you.
We do computer and all kind of stuff. So you can see my movement. You know, when I'm moving it, what happens is the tendons here get irritated. And tendons get irritated, you get stiffer and you get stuck. See, like that. So finger cannot move. You cannot extend the finger. You got a trigger finger. So what do? You bend the knee, slowly open it out and do that.
Okay.
So trigger finger is common. The other common problem is a carpal tunnel. When you do like this, the nerve here, called the median nerve, it gets impinged. It gets pinched. And when it gets pinched, the scar tissue builds up. When scar tissue builds up, it compresses the nerve. And when it compresses the nerve, you get tingling and numbness, these three fingers. Index, middle finger. You shake it a little bit, nighttime you shake it. Sometimes pain comes up to here. So these are the common problem in modern computer.
Sure. I mean, we all use computers. So is there any way to avoid this? Any exercise or something we can do differently?
Well, you can.
Just like that?
Yeah. Exercises, there is nothing exercise. I think if you develop some symptoms of these, just be careful. Either you have a splint here, so use a splint to do this, or sometimes it bothersome, you have a steroid injection to relieve the inflammation. And very rarely, if it becomes stuck that you can't move, then you may need surgery to release the tightness. Or you may need surgery here to release the tightness. Fortunately, for carpal tunnel, for example, we can do arthroscopically.
Come back to that the
carpal tunnel. Yeah.
The carpal tunnel. So there's nothing, no exercise except just stretching the.
Yeah, well, I think the doing computer by itself is an exercise.
Is an exercise.
Right, yeah.
Okay.
But I think anything which you do repeated movement, for example, you get irritation of the tendons. Okay, so it happens to these. Okay. And then there's nothing more you can do.
So anything for the healthy bones and, from that, structure of the body, which is very important. Is there any diet necessary or not really? Or vitamins or anything?
Well, I think the diet and nutrition is an integral part of the body. Okay, so it's good to have it, yeah. But is there anything specific for this? I don't know.
Okay.
I don't know, yeah. But if you're deficient in vitamin D, if you're deficient in iron,
sure,
it's a good idea to do this, yeah.
Excellent. Dr. Patel, thank you so much for your time, and we are really looking forward to looking your presentation at the Health Expo.
All right.
Thank you so much.
Thanks again. Appreciate it very much.
Yeah.